Bill. I have known Dr. Bill Clark for many years as we are both members of the UU Church in Brunswick, and I also call Bill a friend. Bill graduated from Harvard Medical School, served in the Epidemic Intelligence Service at the CDC, and did a fellowship in health services research at Harvard School of Public Health. At Cambridge Hospital from 1971 to 87, Bill directed the medicine residency and was assistant professor of medicine at Harvard. Dr. Clark practiced general medicine in Bath and was medical director of the Addiction Resource Center in Brunswick from 1987 to 2005. Bill is also chapter lead for Maine All Care in Brunswick. Dr. Clark comes to us today to speak about universal health care. And why is that? He said that he is sad about healthcare injustices, distressed that the US healthcare outcomes rank so low, and is hoping today, by speaking with us, we will get involved and assist in establishing universal healthcare in Maine. So I welcome to our network meeting, Bill, and thanks for coming today.
Hi, everybody. And thanks for inviting me to speak, and thanks for that lovely introduction, Lynn. I really appreciate it. I highly value the advocacy of the Unitarian Universalist Social Action Network here in Maine. So it's my pleasure to imagine assisting and partnering. I've been a UU for 35 years or so, and my wife, Kathy Cyrus, and I attend the UU Church in Brunswick. I appreciate the fact that Lynn has gone over my background as an internal medicine physician and my longstanding interest in health policy matters, including that year at the Harvard School of Public Health in a fellowship focused on health policy. I've had Maine connections since childhood, and Kathy and I moved our family from Cambridge here to the Mid-Coast area in 1987. And I joined Physicians for a National Health program when it was first formed decades ago. And then the local chapter of Physicians for a National Health program, that is Maine All Care, 8 or 9 years ago. I'm currently the chapter leader for the Greater Brunswick area chapter of Maine All Care. In late 2020, I joined with other Maine All Care folks to establish Maine Healthcare Action, which Lynn mentioned, and I'll tell you more about in a moment, a C4 group so that we could promote a citizen initiative. So I want to talk a little bit more about the money and the will. That was the title of my talk. What about the money? And what about the will to get universal health care passed in Maine? First, money is not the problem. I'll read a quote from a healthcare economics book by Stephanie Kelton, who is a professor of economics at Stony Brook University. Ms. Kelton has served on congressional committees dealing with finance in various ways and consulted with Bernie Sanders. So she's well informed about specifically healthcare issues. So her book is called The Deficit Myth, Modern Monetary Theory and the Birth of the People's Economy. Here's the quote. The truth is, the federal government is nothing like a household or a private business. That's because Uncle Sam has something the rest of us do not have, namely the power to issue US dollars. Uncle Sam doesn't need to come up with dollars before he can spend. The rest of us do. Uncle Sam will never go broke. and onto healthcare. Still in quote, at the very least, we know from modern monetary theory that our failure to provide proper insurance and care for every American is not because the government can't afford it. By settling for a system that provides coverage through a fractured web of private insurers, employer plans, and patchwork government programs, we've created a system of bottlenecks in which hospitals, providers, drug companies, and the private insurance companies can squeeze us for every last dollar, and in which bigger profits lie in making it harder for people to access care. We've all experienced the truth of that profit squeeze and its painful consequences, at times a little and sometimes in an agonizing way. For me, her quote and her book sums it up regarding healthcare for everyone at the national level. In my subsequent comments, I'll describe how Maine All Care and Maine Healthcare Action strengthen the will in citizens and legislators to improve healthcare for everyone. First, a little bit more about Maine All Care. As I mentioned, it is the main chapter of Physicians for a National Health Program, which focuses on the national issues. Maine All Care's sole mission is to advocate and educate about establishment of publicly funded healthcare coverage in Maine through community activities and testimony at the legislature. Maine All Care membership peaked at about 40,000 supporters, with a dozen chapters throughout Maine. However, as COVID diminished opportunities to conduct public meetings, Maine All Care has only 3 active chapters at present. However, we send out email alerts regularly, and a monthly newsletter is published to keep people up with the latest about what's happening both nationally and in Maine. So why does Maine All Care support universal publicly funded healthcare? Publicly supported healthcare supports community, after all, which is a foundation aspect of American democracy. Publicly funded healthcare for every Maine person is affordable, equitable, comprehensive, relatively hassle-free, and feasible if we have the will. More on that in a moment. Publicly funded healthcare benefits everyone. That is to say, patients, physicians, and other clinicians, employers, employees, businesses, cities, towns, the state of Maine, hospitals, offices, and labs. That is everyone. We can, of course, explore more details if that seems appropriate as we go along. Let me cite Maine All Care's key efforts that we hope will become part of building the will in citizens and legislators to get universal health care for all Maine. First, Maine All Care conducted a statewide survey, which is funded by the Maine Healthcare Access Foundation, Maine Health Access Foundation, of 4,000 Mainers. Its key results showed that 500 people said healthcare was affordable, but a little over 3,000 said it was not affordable. Further, in response to the specific question, if the federal government is unable to pass universal healthcare coverage, and there was a referendum to create a publicly funded healthcare system that covered everyone in Maine, would you lean towards being in support or opposed? A strong majority leaned to support, 3,100 versus a few over 200. We think this is an important signal about where Maine people are at with respect to getting something done. Secondly, Maine All Care showed the economic feasibility and practicality of a Maine state-run program, commissioning a study by the Maine Center for Economic Policy, which was funded by the Stephen and Tabitha King Foundation. The full study text with all the details about money and so on is available on the Maine All Care website. Maine All Care has helped towns, individual towns, pass resolves calling for the legislature to pass publicly funded health care. In fact, as of this date, 11 towns have already passed such resolves, including Bangor, Orono, Brunswick, and many others. The resolves, each of them, are viewable on the Maine All Care website also. As Lynn mentioned, Maine All Care testifies at the legislature, and we worked closely with Representative Brooks and other supporters of LD 1045. We were pleased but disappointed as well when 1045 was greatly abbreviated and amended in order to get it to pass the full legislature, which it did. But it is now restricted to appointing a 17-member board to implement and design a plan. But that action to appoint a board will not begin until a federal bill passes, which makes it easier to develop state-based plans than has been possible under the ACA. In fact, a bill now in Congress, HR 1976, which would make state-based plans easier to develop, is co-sponsored by Chellie Pingree, but unfortunately not Jared Golden. So in a way, we've made great progress here in Maine. On the other hand, we're still in limbo. Good news and bad news. Finally, of course, Maine All Care supports a citizen initiative with our C4 partner, Maine Healthcare Action. Let me tell you a little bit more about Maine Healthcare Action. It brings together a strong board. Its chair, Dr. Larry Kaplan, brings a history of social action in Minnesota, Cambodia, and Haiti. And Larry was a member of the board of Maine All Care before we started Maine Healthcare Action. I'm the vice chair of that board. You'll recognize the high level of advocacy that Betsy Sweet and Lisa Savage bring. We're so pleased they're on our board. Two physicians in direct primary care practices in Portland have recently joined. Linda Robinson, a nurse midwife who is in fact head of the Nurse Midwives Association here in Maine, has just now been recruited to the board. And she joins another nurse, Alex Newell, who has worked with National Nurses United for a long time and is a part of that organization nationally and here in Maine that supports universal care at the national level. So getting perhaps to one of the key points, Maine Healthcare Action wrote and now promotes a citizen initiative resolve to fortify the will for change here in Maine. By law, the full resolve is available on the reverse page of every petition signature page. And of course, you can find the whole thing at mainehealthcareaction.org. A summary of the initiative, which is on the front of every petition signature page, reads as follows and describes what this is all about. This quote, "This initiated bill directs the Joint Standing Committee having jurisdiction over health matters to develop legislation to establish a system of universal health care in Maine and directs it to report out a bill to the legislature to implement its proposal by 2024. I will not read the entire resolve, which states the 8 ostensible reasons for the resolve in its preamble. Then there are 8 principles that should be incorporated in legislation are specified. In short, the preamble states the problem, and the resolve states demands that the legislature develop a program that brings publicly funded comprehensive healthcare to all Maine residents. I'll speak a little bit about our strategy. Citizen initiatives have not had success in other states. What has happened is that they stated details of proposed legislation, which of course is lengthy, very lengthy, and quite complicated, since provision of universal care is a complicated matter once you start thinking about hospitals, labs, providers of all kinds, and so on. So it made for quite easy bait for opposition to speak up about. They claimed about it was too expensive, the hospitals will suffer, doctors won't participate, and so on. So therefore, we chose to leave out all the details and demand that the legislature do the right thing. We hope that this strategy will minimize the misleading and false claims coming from the deep pockets of opposition that have doomed initiatives in other states, and allow our initiative to get on the voters' ballot in 2022. So the Maine voters as a group can speak to this issue in a clear and straightforward way. I'll stop here with my prepared comments, and of course, be eager to participate in whatever conversation we can develop as we go ahead. Thank you again for inviting me to speak.
Thank you, Bill. We now are going to proceed with a question and answer time so that you can ask Bill the things that you really want to know. And to do that, if you would put your question in the chat, I will read those questions to Bill. And so I'm reading them aloud so everybody can hear them, even if you don't participate easily in the chat. So go ahead and ask your questions. And I will start while you're all getting ready. Bill, I think a question that is an important one is, I think it's hard for people to understand how money shifts from the present messed up system to a universal health care system, because the money is clearly there because we pay for insurance right now. But the shift, how does that shift happen? I've had a lot of people ask me that.
Well, of course, that's one of the most key questions. And the basic answer is so scary that people cringe when I give the basic answer, which is that we would pay for it the way we pay for all other publicly funded services that the states and towns provide. We provide for our legislature, we provide for our fire departments, we provide for our libraries and so on with taxes. So as soon as you say the tax word, people get terribly worried. And it's difficult to appreciate that the data show clearly in many, many states that have done these studies, and of course, internationally as well, that joining everybody in a single group to get health care, which is funded by a single entity, saves a lot of money. So in the end, at least 90% of people would pay less for their health care than they're now paying. It's just that it would look a little more like how they pay for their fire department. And that worries people so much.
I gotcha. Somebody asks, Lynn Ellis asks, what is the HR number for the federal legislation again?
Yep, 1976.
Okay, got that, Lynn? And Jane Macula asks, what can our congregations be doing right now to help?
Oh boy, that's a tough one. And I think basically it urged people to join MUUSAN and be part of what's going on at the state level. It's hard to do much at the individual congregation level, although of course promoting this citizen initiative will be very helpful. If people wish to volunteer to be signature gatherers, that would also be a huge help. And we certainly would appreciate that. We need as many feet on the ground as we can get. It's expensive to pay paid signature gatherers, and we'd much prefer to use volunteers. Furthermore, individuals could give us some money because running this kind of a campaign is expensive. You know, our office expenses, getting everything printed, hiring a couple of staff people to run the whole thing, et cetera. So people can give money and people can get their feet on the ground to collect petition signatures. Those are a couple of very straightforward, active things people could do.
So Trudy asks, what is the best way for MUUSAN to help with this effort?
Just to keep up with the legislative work and talking with legislators.
Great. Ivy Labato asks, would this universal health care also include mental, dental, eye, and long-term care?
Oh boy, another, it's a simple and difficult question. The simple answer is everything will be included that the legislature decides to include when it writes its bill. So that, of course, we all want that to happen, like an improved Medicare for all. But we have intentionally, as I said, left out all the details so that we are much more likely to get this on the ballot and therefore demand as a citizenry that the legislature do the work of designing and implementing a bill. I think it's pretty clear from national work that dental, vision, and hearing would be very likely to be in any bill that was created in the future.
Okay, Delene Purley asks, how much progress have we made toward the number of signatures that are needed?
The last count that I heard about, which was actually a couple of weeks ago, we were at about 10,000 or so signatures. I know that at the individual level, it seems so minuscule. Like if I stand outside the post office in Brunswick for an hour, I can get about a dozen signatures. I've done that a number of times, and it's quite predictable that about a dozen people say, "Hey, screw off, buddy," and another dozen people say, "Oh, of course I'll sign," and do sign up. So there are many other folks like me who are out there working from day to day, and those have not been added up yet. Unfortunately, the Common Ground Fair, which would have been a great place to get signatures, as you know, has been canceled. I went to the Union Fair, which did happen in person, and succeeded in a 3-hour shift located with myself and another person located in a very out of the way spot at the fair, nonetheless succeeded in getting a little over 30 signatures from people in 23 different towns, which was fun. I really enjoyed the experience. You know, people like to talk about this once they've agreed to chat.
Who are the 10%? Ward Clark asks, who are the 10%? who will pay more for universal health care?
Oh, it's the people who stand to pay higher taxes on initiatives of this sort, which basically are the wealthy people with incomes well over $150,000 a year. And there are quite a few of those right here in Maine, as you know.
Who do we contact to get petitions?
MaineHealthcareAction.org. We have, our campaign organizer and a helper who are constantly working on this. So a very simple visit to the website and punching the button that says, I'd like to volunteer, will get you on the list and quickly get you out on the streets with petition signature pages. It's quite easy to get signatures, as I've mentioned, even though many people say no thanks. But it's a little complicated to do all the paperwork that goes along with turning in the signatures and getting them verified and so on. And that's what our central office does. Each petition page needs to be notarized, and it needs to go past the town clerk in the town of the signers of the petition. And as you can imagine, with many hundreds of towns in Maine, that does get to be a complex business. That's what our office staff will be dealing with. Oh, by the way, for volunteers, there are online sessions about how to gather signatures and the details of the matters that I've just been talking about, getting them notarized and turned in and properly counted.
Thank you. I want to apologize for all the background noise. Two of my children decided to come and repair my kitchen door. Just
Terrific. What luck.
Just as this started. So I've moved. I think we won't be disturbed again. So Lynn Ellis says, many of our healthcare issue group members have become signature gatherers, and we will talk more about that in our breakout group. So that's not really a question for you. That's more a little bit of encouragement that we are there to help. So Ward Clark asks, how can wait a minute, how can you sign a petition without waiting to find you at the post office? I'm not quite sure what that question means.
I totally understand the question. I mean,
Oh, okay.
Where in the world do you find a petition to sign?
Okay.
And, it's at the moment it's quite chancy, since there are not public venues where we can be, like at the Union Fair or the Common Ground Fair and so on. At the very worst, you can wait to the last minute and go to the polling places for the November election, because we already have at least 100 people signed up for towns across Maine at the polling places where we will have petitions available to be signed.
Okay. Renee asks how many signatures are needed for the citizen initiative, and Jill answered 63,000.
Right. And
So
we figure, based on past experience, we figure that means about 80,000 are needed, because there are always duplicates by people who sign more than once, forgetting they've already done it. Or as I've done at the post office, with people who say, well, I think I signed this. Maybe it was a couple of months ago, but I'm not sure. I say, sign again, so that at least we know we have your signature at least once. And, the Secretary of State takes out all the duplicates. They're very, very careful and thorough about that.
Another question, as a Medicare recipient, I'm myself curious how Medicare for All in Maine might connect with Medicare for All, or is there anything to learn or any association between Medicare and the plan for Maine?
Well, since Maine doesn't have a plan, there isn't any association. However, it's an open question whether, let's see, let me go back a step. Clearly, to do a state-based plan, we need the federal dollars that currently go to healthcare, through a huge variety of programs, including Medicare and, most importantly, of course, Medicaid. It's not clear whether the federal government would agree to give the state the money with no strings that is now used for Maine All Care, that is Medicaid, or Medicare in the state. That would be the simplest way. So it's more likely that the federal government would continue to pay the money and people would stay on Medicare. Medicaid and Maine All Care is not Maine All Care. Maine Care is another question, and it might be more possible for all those federal dollars to be administered by the state, fully administered by the state. So those are difficult questions that, of course, would take a couple of years of negotiations once it was agreed that something was going to be done in any given state. And I haven't mentioned so far, but I will now, that there are at least 15, probably closer to 20 states who are doing just what we're doing here in Maine. That is to say, trying to develop individual state plans, which will be contingent on the passage of bills like HR 1976, which is why that bill in the US Congress 1976 is there, because people recognize the fact that many, many states are working on this. I know that, for example, in New York State, both houses of the New York legislature passed bills, but the governor refused to sign. So, there's very strong support in the state of New York amongst the legislators, who are the key people, of course, in this issue at the state level. In the state of Washington, there's great support in the governor's office, but less in the legislature. In Minnesota, very comprehensive bills have been written with modicum support by the legislature. In California, over a decade ago, the state passed appropriate bills, but Governor Schwarzenegger refused to sign them. So, we're only a few steps away in many states. And those last few steps, just like getting to the top of Katahdin, are always the hardest.
Okay. Ivy, who asked about whether it would include mental, dental, eye, and long-term care, asks if medication is included as well.
It's quite clear that since the drug companies are a big part of the squeeze with totally inappropriate fees for drugs, that they would be the big losers. Although, of course, they're so rich at the moment that losses won't matter very much. No, the drug pricing will definitely be part of the deal, which is, all other nations closely regulate and tightly regulate the prices of drugs that are sold to their people. And we need to do that. We're just way behind and still working on, the profit motive.
Yes. Okay. We have about 4 minutes left. And Delene Purley says to everyone, hopefully everyone from District 2 will work on Golden to help him get on board. That's, I think, a hope rather than a question.
I'll mention that one of the things that I failed to say Maine All Care is doing is, in fact, pushing hard on our supporters who are in District 2 to speak with Representative Golden. And I know that that is in fact happening, and that delegations have gone to his office from Maine All Care of people who live in that district and are willing to stand up and talk with Representative Golden.
Great. Well, this is your last chance to ask any questions, anybody out there. I'll wait just a minute in case you are in the process of forming a question. And Bill, if you have anything, any last minute things. Oh, there is one that says, Bill, what is Golden's objection?
Oh, he's, as you may know, he's pretty closed-mouthed about these things. I have not talked with my fellow Maine All Care members from District 2. So I don't know if he may have said more, but he's been very careful about what he says about his policy positions. Sorry, I don't have more.
Great. Is there anything you would like to say in closing?
No, just how much I appreciate the work of this organization. I mean, it's just so important that the communities speak up, and that's exactly what MUUSAN does. So many thanks to people for what they're doing and for inviting me to talk today. It's been a great pleasure.
Thank you ever so much, Bill. It's been a pleasure and I think very informative for us. And if you hang around and perhaps go to one of the issue groups or stay for a coffee hour or our conversation at the end, you're very welcome. Whatever pleases you. We are very happy to have you with us.
Thank you so much. I'm afraid I won't be able to hang around for the rest of the session.
Well, it's lovely that you came and gave us your time. Thank you so much. And we know now how to find you.
Wonderful. I love all the questions. You did a great job.
Thank you. And everybody, I'm getting a whole lot of chats that say thank you, thank you, thank you. So thank you.